Hey everybody, Dr. Schultz with the Centennial Schultz Clinic with another weekly update. It's hard to believe it's the summer of 2024. Thank you for checking in. Today we're going to be talking about the 7 major causes of anterior shoulder pain. The goals of this presentation are to review in the basic anatomy of the shoulder. What do I mean by anterior shoulder pain? And most importantly, what are the 7 major causes of anterior shoulder pain? Now, the shoulder joint, as we know it, has 2 major joints. There's what's called the glenohumeral, basically the large ball socket joint. And then there's a second joint, basically where the collarbone comes across and then forms a joint with the acromion. It's called the AC joint. The other things that you need to know about are the rotator cuff, which we'll explain, the bicep, basically the Popeye muscle, and then the ligaments, which are basically connective tissue that stabilize the joint. So what I mean by anterior is in the front. So just as is depicted here in the arrow, basically what are the 7 causes of anterior shoulder pain? So number 1, the rotator cuff. The rotator cuff in summary is 4 major muscles and tendons. They're depicted here. They're the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. They stabilize and they move the shoulder. And what's interesting is they attach to the bone right here in the front. So one of the major causes of anterior or frontal shoulder pain is inflammation or injury of the rotator cuff. Number 2, the Popeye muscle, the biceps tendon. The bicep muscle is a well-known muscle, and it originates up here high in the shoulder, right anteriorly where I depicted here. And then it's got 2 heads. And if there's irritation or injury, it can result in anterior shoulder pain. Number 3, a slap tear. A slap tear is an anatomical description of a tear in the labrum. The labrum is simply a ring of cartilage that surrounds the socket in the joint. It's depicted right here. So it's just a thin little cup that helps stabilize the shoulder. A tear or irritation in there can cause anterior shoulder pain. Next one is shoulder arthritis. You can either have breakdown in the cartilage and additional spurs, which can cause anterior shoulder pain. This x-ray shows you that you've got some significant arthritis in both joints, both the AC and the glenohumeral. The next is ligament instability. Those pieces of connective tissue that stabilize the shoulder joint can be stretched or injured, and as a result, you can have some instability leading to shoulder pain in the front. Another cause is AC joint instability or arthritis. Again, the AC joint is the union of where the collarbone meets the acromion, and it is a common source of pain and irritation. One of the common ones here in Colorado is going over your handlebars on a mountain bike. And you can really cause some severe injury to the AC joint. And the last significant cause, which is oftentimes overlooked, is it can be referred pain from the neck. It can either come from the disc and or a facet and or irritation of one of the nerves that are coming out of the cervical spine. At the Centennial Schultz Clinic, we are experts in the evaluation and treatment of anterior shoulder injuries. Here you will have a board-certified, fellowship-trained physician. We offer a customized PRP and bone marrow concentrate for your treatment options for shoulder and other injuries. I hope this was helpful. We reviewed the 7 major causes of anterior shoulder pain. I'll see you next week. Thanks so much.